a new initiative by Qatar Stories, where every week we bring to the discussion issues of your concern. And in the ice-breaking session today, we will discuss how can we support ICBF, an organization which is serving the community for the last 35 years in Qatar, and especially in the ongoing pandemic of COVID-19. Team ICBF has performed extremely well. And now it is our turn to support the cause. How? Let's figure out. Now, joining me in the discussion are the leading key pillars of Indian community. Let me introduce to all of you. Today we have Dr. Mohan Thomas, Chairman, Advisory Council, ICBF, and founding father of Indian Doctors Club. We have Mr. P.N. Baburajan, President, ICBF, Mr. Azeem Abbas, President, IBPC, and Mr. Nishad Azeem, CEO and founder, Coastal Qatar, and Executive Director for KIMS Medical Center. Gentlemen, I welcome all of you.
Thank you. Good to be here.
Babuji, I would like to start with you. You are the president of ICBF. We know ICBF, for the last 35 years, you are serving community. There are so many different aspects, different factors you people are taking care of. But if I talk about in the present scenario of COVID-19, so what are the main areas ICBF is focusing these days?
Anuji, thank you. Because here we are facing different types of issues now.
Mm-hmm.
So people get panic as they are not able to return to their home country. Those who lost the job, those who are stuck here in visit visa, chronic patient, and somebody lost their job, no business, somebody no stock medicines, and they're not getting from HMC because of their own visit visa. And like those businessmen who lost the business and crisis, debts also coming up because of no business, no income. And the saddest part is nobody in a position to help such a way earlier, And if I say this is what Qatar expected life now, it is merely through assessment of our day-to-day life now.
Mm-hmm.
Everybody is afraid of that bad day where coronavirus catches us. And ICBF also doing well because we are coordinating, the food supply to the community. So many ways we are working with that team. Thousands of people received our food packets, still receiving, and hundreds of people received our medicine aid, medical support, and there are many people received rental support from ICBF, and so such a way we are working together with the community, together with the embassy. Now main problem, as I mentioned earlier, how to reach our own home country. That is the main we are facing.
Mm-hmm.
Many calls receiving means many calls are receiving. Sir, please send back us to our country. So the reason, as I mentioned, no job, no income, somebody no visa. So many that kind of issues at the moment. So I need more support from business people to support those who are our brothers.
Mm-hmm.
So
and this is what the agenda of today's program is. We are trying to support, in fact, the whole Indian fraternity, the whole Indian community. We try and support you. But here, Dr. Thomas, I would like to bring in you to the discussion and ask, because you're leading a big team of medicos, paramedics, there are counselors, there are so many people are involved. Other than these challenges, what Babuji mentioned, what are the set of challenges that you people have to go through, and what do you think can be the right solution to that?
As the President of Indian Community Benevolent Forum, Mr. Baburajan said, this is a fight against an unknown enemy with all our might and force. There's a saying in English, if we can take care of hunger and anger, then it is easy to deal with that person. That's what ICBF is doing. The Indian Doctors Club and the doctor community and the other paramedical community, pharmacists, everyone has joined hands with ICBF to fight this calamity. Basically, we come across two kinds of problems here among the patients. One who thinks they have got COVID infection. The second is non-COVID patients who require medications for their illnesses, acute or chronic. When we get a call in the helpline of Embassy and ICBF, all medical calls are transferred to our team. There is a 15-member team who works relentlessly every day to take care of this problem. The COVID patients have an anxiety to know whether they have got COVID infection. For those residents who have an Hamad Hospital card, we using that Hamad Hospital card number, we are able to reach the consultants of Hamad Hospital and to prescribe the medications. Those have expired their Hamad Hospital card, we are able to renew it for them and then get medications for them. Those who have never taken a Hamad Hospital card, who are permanent residents of this country, we are able to create again a temporary health card for them through the emergency department and provides all medicines for them. The other major area of concern patients have is because of their anxiety, depression, and their difficulty to face this current problem. We have a group of doctors, psychiatrists, and counselors who are able to take care of this problem 24/7. We counsel them, rehabilitate them, even sometimes have to medicate them. So overall, the Doctors Club provides a great facility of healthcare and mental health care.
And we are really proud of you. You are the true frontline warriors, who are saving us. But Azeem ji, being the president of IBPC, I really support everywhere you mention this. You directly conveys this message that IBPC supports ICBF. And now this is the time. वो कहते हैं ना कि बड़े बड़े खजाने भी खाली हो जाते हैं. So this is the time, I think, कि उस organization को individually हम सबकी अलग अलग corporate houses की, business houses की, हम सबके support की जरूरत है. So what do you think? How at the most required time IBPC can be an asset to ICBF?
Good evening, everybody. Thank you, Anuji, for having us all on your platform. मुझे ये लगता है कि आपने जो ये बेड़ा उठाया है, ये खुद एक जो है सो बड़ा मैसेज दे रहा है. It sends a very good positive message to people all who are watching. Why just IBPC?
True.
Okay, IBPC will be and is always, we are all a very close-knit Indian community.
Very
okay,
true.
And ICBF from so many years has got such a goodwill amongst the community. Okay, that मेरे को नहीं लगता कि आज हम 2 महीने हो गए हैं और ICBF को कभी भी ऐसा लगा होगा कि oh my God, we are just against the wall now. There is no way to go forward now. I don't think so that Babuji has ever experienced this, because मेरे को ऐसा लगता है कि ऊपर वाले ने हम हिंदुस्तानियों को इतना बड़ा दिल दिया है कि हमको जो है एक दूसरे की सहायता करने के लिए और मोहब्बत से रहने के लिए जो है ना, ये एक स्पेशल वरदान हुआ है ऊपर वाले की तरफ से. और मुझे ये लगता है कि यानी जो काम बाबूजी ने ये कोविड-19 से पहले किया है और इनके पहले के जो प्रेसिडेंट भी जो काम करके गए हैं, तो ICBF is really commanding a very good image amongst the Indians and amongst the Qataris.
Very true.
So there are many times that we believe, we know that ICBF is getting access to the places where not even like locals or any other people can go because of the goodwill they have. Okay. Now regarding that IBPC is supporting or will support or will always back ICBF, it is very common. It is something which comes very natural. We have amongst us, okay, a family of nearly, if you say the businessmen and the professionals, and like we are like nearly, I think like 7,000 people. Okay, believe me, we have not yet started our campaign to support ICBF in the way we should. And I have told Babuji that it will go slow. First, you exhaust your means, okay, and then we are coming, and we are coming in a very big way. Now the thing is that we are in the second month now. Nearly 2 months are over. Okay,
yes.
And I feel that very soon we will come into a stage where the demand for help will grow. But the challenge is now that these jobless people,
Mhm.
जिनके jobs चले गए हैं for whatever reason, okay? We know that what we are going through. So we should
Absolutely.
not hide the fact and we should not feel shy about addressing this
And it is
question.
global.
Yeah, it's global, okay? So now these jobless people, to handle them will be a very big task.
True.
we, Babuji, I'm telling you, in the next 2-3 months, you'll have a massive kind of requirement for all kind of food and medicines.
True.
And I think that as per your planning, I feel that we are well prepared. And even like IBPC is internally preparing now to come out in, like we expect, like mostly by the end of July or August, we'll have to once again come very strongly behind ICBF and back it. So definitely IBPC is looking forward to this, and we really appreciate the work that Babuji and his team are doing 24/7. You just call them for anything, they will never say no.
Believe me, and after listening to this statement, such a strong statement from the president of IBPC, I'm feeling so very relaxed and happy. And the kind of vibes, the kind of understanding which is there in between all of you, that is really commendable.
I just also want to chip in Manikantan, the ICC president, and Hassan Chokle also, like they also been supporting from all the areas where they can work, and we all gel together.
And this is the need of the hour. And Nishad, Azim ji, आप सुन रहे हैं बहुत देर से, you are affiliated to IBPC as well, or अगर individual capacity में मैं आपसे बात करूं, because you run such big ventures, and whenever there is any need, so I would not call it a burden, but this responsibility, it comes on to the shoulders of corporate houses. We do look forward towards you people. What is expected in a generalized way? I really want to ask, be it small, big, a business house, some very big industry, a very big corporate, a medium sector business owner. What is expected at this point of time? How you people can be an asset, a support to ICBF or to the community?
Thank you, Anu, for having me, and it's great to be with the forefront soldiers like Babuji, Dr. Mohan Thomas, and Azeem ji. With regards to what corporates can do in these challenging times, I believe the first and foremost thing is to take care of its employees. The safety of the employee should be the paramount activity that the company should be doing right now. They should be training the employees on COVID safety. They should be able to provide the adequate PPE to the employees, and whenever possible, allow the employees to work from home. And if it is required for them to work from the company, within the company, then a proper sanitized work environment that is safe should be provided. In addition to the safety of your employees, another important aspect is communication. Honest and reassuring communication is very important. As leaders, your people look up to you to provide them guidance. And if you're able to communicate to them how you plan to overcome the challenges and how the future looks like, that provides a lot of reassurance to your workers. Another very important aspect is to show empathy and compassion and moral support to build grit and resilience in these tough times. If every employee took care of its employees, the load on organizations like ICBF would greatly reduce. We understand in reality it may not be possible for all organizations to do that due to various reasons and constraints. That is when organizations like ICBF can step forward to provide support.
So the message is very clear, all these little things, whatever staff you have, अपनी salaries time से pay करें, just make sure that they get best of the environment, working, be it hygiene practice, social distancing, and just, have this feeling of sympathy and empathy with them that, all together we are one family. But gentlemen, you all are there. We had discussed about corporates, about organizations, but what about individual efforts, because every drop counts. So what
True.
about all of us? Just just consider ourselves that okay, मेरी कोई बहुत बड़ी identity नहीं है, एक layman की तरह ही जो भी मैं contribute कर सकता हूँ या कर सकती हूँ. Let's make an appeal on individual note as well. All of you, I want you to please come up.
Actually, I strongly believe, we are the best community in the GCC countries. Such a coordination going on here. Everybody, every organization all associated organizations like Azeem Bhai said, all apex bodies, presidents. Every day we are meeting online. Online means through the messages. What kind of next step we want to take it up. And I received many times call from Mr. Nishad Azeem. Babuji, मैं कभी help करना है. मतलब, he asked me many times. I said, Azim ji, I will ask you. Because now we are using from our reserve fund. But I will ask you because this is not the good time for asking you. Because he always come forward to support ICBF. So I stopped him that way. Even Azim also called me. When I want to start the campaign, I said, sir, I will talk to you later. So we are the best community. Yeah, we are the best community. And we have very good ambassador and Indian officials. Wherever we want their advice, they're doing it. Okay, the community, individual basis also, we are receiving every day good amount of support and food kit. Even today also I received 25,000 Qatar riyal from different individuals. They are not very active member of ICBF, but they heard from the social media, so they come forward and donated through our page.
That is the intention here. If you have that intention, then you will find some way or other to help. Because we are running on a very strict timeline, gentlemen, I would request you to make a quick appeal individually, your message for ICBF or publicly.
That's true. That's true. Okay, as a media personality, you can definitely do very good support for us through your media.
We are all
that is your way of approach.
True. Very true.
That's your way of approach.
As corporates, I believe that there is a moral obligation on us to support organizations like ICBF. We could support them financially through the approved channels. We could support in kind, for example, providing our vehicles for the logistics related to delivery of relief materials, or we could volunteer our time, like some of the doctors have been doing. And if you feel that this cannot be done, there is another thing that doesn't cost us anything, which is of great value. That is to show appreciation and encouragement to the forefront soldiers who are working on a 24/7 basis for the benefit of the less fortunate. A word of encouragement, a word of appreciation, a word of compassion goes a long way. And I believe all of us should take that effort to recognize and appreciate all the work the volunteers and the members of the ICBF and the community are doing.
Wonderful. Dr. Thomas.
I also feel it's important for the corporates of this country, especially the Indian corporates, to come up with support to the ICBF as a social responsibility. This is a time we are going through a most stressful time in our life.
That's great. Azeem, Abbas, your closing remarks.
I just want to mention Devidas Aswadi again because, one day morning he called me. He said, Babuji, I heard your ICBF doing a lot of community activities for the COVID-19 affected people. So what kind of assistance you want from me? I said, yes, fine, sir. Everything is going up. No issues. Then he asked me, send the account details.
Okay.
Then I sent the account details, immediately transferred a good amount of money to our account. Then my sponsor, he is the ambassador to Belgium. After seeing my social media post, he said, Acha, you are doing such a wonderful work for your community. So what do you want from me? I said, anything. Then he said, okay, I am remitting some amount to ICBF account. So such a way, we are getting support from the people. And Dr. Thomas is making another coordination for collecting fund, I know. And Azeem Bhai also started. So I am very thankful to our vibrant community.
That's great. That's great. Together, we all are one big team. And Azeem ji, you wanted to say something?
Well, the thing is that, like I started, there is so much harmony amongst us, in the community.
It's evident.
Okay? And believe me, there is so much, warmness in the people's heart. Just today, I saw in the group that somebody, people are bringing in big amounts, but Babuji doesn't misses that person also who brought in 300 reals to contribute.
Wow.
Yes.
This makes a difference. This, to me, it really makes a difference.
It's all about.
Yeah, this is, like, it's giving hope
True.
Like 300 reals also does mean a lot. Amongst those thousands of reals what we are getting, in this 300 reals does make a very big difference. So we should welcome all this, and we do welcome all these people. We encourage them to come. Because now the biggest challenge we have is to support the people who are underprivileged. Okay.
Very true.
So that I have seen in a lot of videos that that there are buildings in which they are making some chapatis. Okay. And the entire building, if they are making chapatis in the house, then they donate 5 chapatis each. So
Nice.
50 flats into 5 makes a big difference.
Very
Yes.
true.
So
And
we should follow this. Why not? Yes.
the whole idea of conducting this show, that this is the time we need to support ICBF, to support our community. And one thing is for sure, शायद किसी एक इंसान के लिए बहुत challenging होगा कि वो सबके लिए कुछ करे, but I think if we decide that okay, only one has to help one, so everyone can help, at least one individual. And with this, gentlemen, thank you so very much. I am feeling very honored after this entire discussion. God bless you all. Stay connected, and Qatar Stories is always there for your support, for anything we can do all together. And looking forward, in fact, I would like to say to my viewers as well that whatever support you are thinking of bringing into ICBF, it can be in any form, right from chapati to whatever little money you have. Please contact ICBF Helpline Desk. Our volunteers will get in touch with you. And please remember, every single drop matters in the ocean. With this, gentlemen, thank you so very much. Very soon we'll see you again. Till then, take good care of yourself. Thank you.
Thank you.
Thank you.
Thank you.
Individually, we cannot support everyone, but each one of us can surely support someone. Please come forward, support ICBF and serve the community. That's all from the debate upfront. Next week with some new topic, I'll see you again. Till then, take good care of yourself, and how you find out today's episode, do write us. Take care.